It's the AEMT lecture series. This will be video number 3 for chapter number 8, Physiology or Pathophysiology. Welcome back. Hope everybody's doing well. We're going to be discussing today the inflammatory response, and we're going to talk about it. So let's just jump right into it and get to the good stuff. All right, so this is a PowerPoint or notes I use for the sepsis chapter, but let's look at this and let's kind of start it off with a scenario. A dispatch to a local residence for a 20-year-old female with foot pain. Find the patient sitting in a recliner with her feet propped up. States she got back from a mini vacation. All right, and that's where she was at, and she spent the weekend at the beach, and she cut her foot on something while walking in the ocean, possibly some coral. She's not real sure. This is a picture of the patient's foot at the time of injury. However, over the past several days, her foot's become increasingly painful. She developed a fever, unresponsive to Tylenol. Her skin's pale, dry, and hot. She's got a heart rate of 110. Excuse me, 110. She's breathing 24 times per minute. And her blood pressure is 100/60. We don't have a thermometer available, which that shouldn't be the case in today's world. All right, and so this is what it looks like now. Her foot is now red, swollen, and painful. Swelling goes to the ankle. She has no other distress. Patient's chest patient should go to her local urgent care or primary care, and an AMA is obtained, a patient refusal. And the next morning, the next shift gets dispatched to the clinic, doc in the box type deal here. For a patient presenting with hypotension, they find the patient blood pressure of 80/40, her heart rate's 140, she's breathing 22 times per minute, and she has a temp of 101.5. She's sent to the ER. They give her a 500 milliliter bolus while en route to the hospital. Treated in the ER, they do their sepsis protocol. They go in, they start a couple IVs. They draw the labs, including cultures. And they start the patient out on broad spectrum antibiotics, she's being diagnosed with cellulitis with sepsis. She's sent to the floor, and through the night her blood pressure continues to drop along with her respiratory rate. She is intubated, airways protected, with a 7.5 ET tube. She's put on a ventilator, and despite blood pressure support coming from IV drugs, they're really strong vasoconstrictants, and the aggressive antibiotic treatment, she died 24 hours later. So I think that's the scenario, and that's kind of how how serious sepsis can be. And it's all about the body's response to inflammation. And that's why it's important for us to understand that response. And so let's look into that. So let me pull up my board here, my sketch pad, and I'll try to walk us through it. So up here is, oh man, already messing up. So up here is the plasma. Let me get this color right up here is the plasma membrane. Okay, the capillaries. This is your it's where your blood flows, arterial, venous, however you want to look at that. And these here are skin cells. Okay, just kind of getting you familiar with it. And so let's see here. Let me pull my notes back up. Stand by. All right, so what ends up happening here is whatever, cut her foot, a pathogen entered. Okay, let me draw that out. All right, so we have a bacterial type, maybe pathogen, with some antibodies here on the top. Put a little color in here. Okay. And so what does this pathogen do? How does this pathogen get things started? So it's going to release some stuff, and it's going to release something that can cause damage, and in this case we're going to damage here the skin cells. So there's, when we talk about cells, there's all types of receptors, right? And so that's what we have here is a receptor, and it goes to work and on that receptor to damage that cell, and these are called endotoxins. Okay, and these endotoxins are going to start, basically trying to cause damage, trying to cause problems. But when there's all kinds of different types of cells floating around, as immune system monitors, and we have one right here. Let me draw it out. And this cell right here is called a mast cell. All right, and so how do you think this mast cell is going to get involved? And I'm sorry for the drawing, guys. But anyway, so what ends up happening is it's out detecting, and it's going to detect these endotoxins. All right, those endotoxins are going to float over here, and this mast cell is going to detect that. And what's it going to do now? So it's going to start releasing all kinds of chemicals. And the first chemical it's going to release is called histamine. All right, and then the next one it'll release will be the leukotrienes. All right, and then it's going to release something called prostaglandins. I think I spelled that right. Okay, there we go. All right, and so it's going to release these three things here. So while that's going on, so let's just cover this real quick. So histamine, right? It's gonna cause some problems. It's gonna cause vasodilation, right? The leukotrienes are going to cause some bronchial constriction. All right, they're going to cause issues with your respiratory system too. All right, and so then hang on one second. All right, so while these cells right here are being damaged by these endotoxins, we have to remember this is a lipid bilayer. All right, all that means is bi means two, so lipid 2 layer. All right, and so what's going to happen is as those lipids get damaged, it's going to release something, another chemical in the game, right? And that's going to be your acryonic, I think is how you say it, acid. All right, and so what's that gonna do? Well, that is going to release more leukotrienes. And so if you look in the book, and let me just kind of refer to the book here just real quick. It tells you about the leukotrienes. Alrighty, hang on 1 second, I'll find it real quick. Because I already know it causes, you know, bronchial constriction. It's not really good at all. Oh, here it goes. They're primarily endogenous mediators of inflammation that contribute to signs and symptoms seen in acute inflammatory response, including response resulting from the interactions of allergens with the IgE antibodies, bronchial constriction. They stimulate airway mucus secretions and are very effective at increasing the permeability of the postcapillary venules. All right, including those in the bronchial circulation. And they cause plasma protein, right, to start oozing out the tissue. And so we'll talk about that in just a second, because here it is, right here is our capillary. All right, so you see these are nice capillary cells up here. But what ends up happening is all of this stuff starts working on the plasma membrane. Okay, so we have a receptor here. And so it goes to work here. Let me get a different color. Maybe we'll go with something different. Mass orb maybe. All right, so when it starts reacting with that plasma membrane, you have these, I think I'm calling them right. I know the book calls them something like granules, if I'm not mistaken, right? And it causes these granules, all right, to come up and move out and they move out here, and that's like a selector, okay, if I remember right. And so this is kind of like a selector. It's going to have a job and a purpose, and we'll get there. We'll get to that in just a minute. Okay, so it activates these guys. Okay, like I said, they have a job, and we'll talk about that. But let's talk about what's going to happen to this plasma membrane, because it's fixing to. This is where it starts getting ugly. Okay, if I don't, I'll probably erase more than I want to here. Let's see. Probably will. Nah, maybe not. All right, let me redraw this so you can see what happens. These guys are going to start to shrink. Okay. So they're going to start to shrink. And look what happens. When they shrink, there's gaps, right? It's causing gaps in there. What do you think is going to happen? This plasma that's up here, it's going to start leaking out. All right, so I don't know But what we needed to, it's going to cause the plasma to leak out. But I can't remember when I started the video if we defined what inflammation was. So it's characterized by pain, swelling, redness, and heat. Let me see if I can write that here. So pain, swelling, redness, and heat. All right, so let's talk about